and they really need to be made available to everybody on as equitable and as fair a basis as we can. And this is the beginning of a very important discussion in terms of global health and setting new standards for how we regard each other across frontiers as global citizens.
Vaccines that use very cold temperatures are using RNA. RNA is very delicate. Even in the labs, we use RNA, but it's very delicate. You need to use really cold temperatures. It's a new technology. The first time it's being used this widely in humans. We have to learn more, but definitely storage is going to be a challenge.
The World Bank has made available a facility where the countries are also expected to obtain some of the funding to pay the equivalent of what the self-financing countries are contributing. So it's subsidized very much based on international solidarity and contribution by some donor countries and donor organizations. But there's an expectation that now that some funding, $12 billion, have been made available by the World Bank, countries will go to the World Bank or find other means to obtain a certain proportion of the money that they are going to contribute. So I would say that it is highly subsidized as a solidarity mechanism and platform to enable African countries to start to have the vaccine right at the beginning, like every other country, but they are also expected to make some effort. And I can also add that the African Union, the Africa Centers for Disease Control, and a group of private sector partners, including the Exim Bank, are mobilizing funding to cover the rest of what the COVAX platform is not going to be able to cover. The COVAX platform is aiming to cover 20%, and we've heard many times from the Africa CDC that they would like to work with other partners to mobilize the funding so that we can relatively quickly get to 60% of coverage, at least to be able to have the funding to pay for that.